Anaphylaxis. It's a medical emergency that can show up out of nowhere and escalate with, honestly, terrifying speed. So today, we're going to break it all down. What it is, how you can spot it, and most importantly, the critical steps you need to take when every single second counts. Let's get right into it. So what are we really talking about here? Well, at its core, anaphylaxis is your body's immune system just going into complete catastrophic overdrive. It mistakes something that should be totally harmless, like a peanut or a bee sting, for a massive, life-ending threat and launches this all-out, system-wide attack that can, in fact, be fatal. All right, to make sense of this, we've broken it down into 5 key parts. First, we'll get a handle on what anaphylaxis actually is. Then we'll look at the common triggers, how to recognize the signs, the all-important emergency action plan, and finally, what needs to happen after that immediate crisis is over. Okay, Section 1. What is anaphylaxis? Let's take a closer look at what's going on inside this, let's call it the body's overzealous alarm system.
So what's happening at a cellular level? Well, you can think of your mast cells and basophils as the body's little security guards. But during anaphylaxis, they completely misidentify a threat and just panic. They release this massive, overwhelming flood of chemical alarms, like histamine, all at once. And that is what unleashes total chaos throughout your entire system.
Now, this whole reaction can be set off in a few different ways. The one we hear about most is the IgE-mediated reaction. That's your classic allergic response, where the body's made specific antibodies to things like foods or insect stings, but anaphylaxis can also be triggered by other things, like reactions to blood products, or sometimes, believe it or not, the cause is just a mystery.
So now that we kind of get the what, let's move on to the why. This next section is all about identifying the potential culprits. What are the common things out there that can actually set off this dangerous chain reaction?
And this list is probably a lot more common than you might think. It includes medications like antibiotics, even over-the-counter pain relievers like NSAIDs. Then you have the classic triggers we all know, bee and wasp stings, and of course, foods like nuts and shellfish. Even something like latex can be a major cause for some people.
Okay, so how do you know it's actually happening? This is huge. Let's get into recognizing the signs. The most crucial thing to remember is that anaphylaxis isn't just one symptom. No, it's a cascade, a domino effect that hits multiple body systems at once, and it usually happens fast. We're talking minutes to maybe a couple of hours after exposure.
And this quote, wow, this just powerfully illustrates how severe this is. Before the physical symptoms might even be at their worst, a person can experience what's literally described as a feeling of impending death. It's this profound psychological signal that your body knows it's in critical distress.
The first and most immediately life-threatening system to get hit is often the respiratory system. You'll see swelling in the lips, the tongue, the throat, and this can quickly, and I mean quickly, lead to the airway closing up completely. That's on top of shortness of breath, wheezing, and a feeling of tightness in the chest, almost like a really severe asthma attack.
Next up are the skin symptoms. These are often the most visible early red flags. We're talking about intense itching, redness, those telltale raised bumps we call hives, and a deeper kind of swelling under the skin called angioedema, which you often see around the eyes and lips.
At the exact same time, the cardiovascular system is taking a massive hit. It's like the body's entire plumbing system springs leaks. Blood vessels widen and become leaky, causing a sudden, dangerous drop in blood pressure. That can lead straight to shock. The heart can also start beating irregularly or develop chest pain. This is incredibly serious.
And finally, the reaction often pulls in the GI tract. This can show up as nausea, vomiting, diarrhea, and really bad abdominal cramps. It just completes the picture of a body in total multi-system chaos.
Okay, we've identified the problem. We see the chaos. Now we get to the most important part of this whole conversation, the solution, the emergency action plan. This is your clear, no-nonsense, step-by-step guide.
All right, let's walk through this. Step 1, stop the exposure. If it's a bee sting, get the stinger out. If it's a drug infusion, stop it. Get them on high-flow oxygen if it's available. The absolute top priority is keeping that airway open. And then, here it is, the single most important step, give adrenaline immediately. This is non-negotiable if there are any signs of shock, swelling, or breathing problems. After that, medical pros will get IV fluids going and give other drugs like antihistamines.
Now let's talk about the dose, because this is so important. The standard adult intramuscular dose of adrenaline is 0.5 milligrams. That's what's in half a milliliter of a 1 to 1,000 solution. Knowing this number could literally be the difference between life and death.
And this right here is absolutely vital. One dose might not be enough. If the person is not getting better after 5 minutes, you give a second dose of adrenaline. You do not hesitate. This is not a let's wait and see situation at all.
Now let's be crystal clear about something. We've been talking about intramuscular or IM injections. Think of an EpiPen or an autoinjector. This is totally different from intravenous or IV. IV adrenaline uses a much more diluted solution, and it is extremely hazardous if you get it wrong. That is strictly for experienced clinicians in a hospital setting. For almost everyone, IM is the way to go.
So the adrenaline has been given, things are starting to stabilize. Great. But listen, the danger is not over yet. In this last section, we need to cover what happens after the initial response, because these symptoms can actually come back.
After any anaphylactic event, that person has to be admitted to the hospital for observation, period. Why? Because of something called a biphasic reaction. It's like an aftershock, where the symptoms can return hours later, even with no new exposure. A minimum of 4 to 6 hours of observation is needed after all the symptoms have completely gone away.
And the long-term game plan is just as important. The trigger has to be identified and clearly communicated to the patient and their doctor. Their medical records need to be flagged. A medical alert bracelet is a really good idea, and you have to investigate the cause to make sure this never, ever happens again.
So there you have it. We've covered the what, the why, and the how-to of anaphylaxis. It's a terrifying chain reaction that requires an equally rapid counterreaction. You now have the playbook. So the only question left is, if you saw it happening, would you be prepared to act?